Welcome again to the Nourish and Flourish podcast series, where we will bring in different health and lifestyle related topics to you in simple and actionable way. I am Raja Mitra, a technologist from Silicon Valley, California. A quick disclaimer for medical legal reasons. Any of my notes, comments, suggestions should not be considered as a medical advice or consultation in any form. Today's topic is an overview of stroke, treatment, and recovery. This would be informative for the patient as well as the people physically near the patient during the time of the incident. Do you know that stroke occurs somewhat unpredictably, like a silent killer? Do you know the 3 by 3 rule that patients who arrive at the emergency room within 3 hours often have less disability 3 months after a stroke than those who received the delayed care? So, unlike other sessions, we will be spending more time on symptoms of stroke. The actual course of treatment for stroke is well defined and we do have little control over that. As usual, before we start, here are a few statistics. Strokes are the second leading cause of death worldwide and the fifth most common in the US. Together, cardiovascular diseases and stroke cause more deaths than the combined number of deaths in the top 10 list. What is stroke? Stroke is a result of disruption of blood flow to the brain and brain cell deaths due to lack of oxygen from fresh blood. Like heart attack, that is caused by lack of blood flow to the heart, stroke is also called brain attack. The medical term is cerebrovascular accidents or CVA. If enough brain cells in an area die over time, the damage is permanent and may cause permanent physical, sensory, or cognitive disability or even death. There are two main forms of stroke. Ischemic stroke, which is about 87% of cases, and hemorrhagic stroke, which is about 13% of the cases. Ischemic stroke is caused by a blood clot that blocks blood flow in parts of the brain, partially or fully. A hemorrhagic stroke is caused by the rupture of a blood vessel in the brain, causing blood to leak into surrounding brain tissues. Worldwide, stroke is more common in men than in women, but the difference tends to decrease with age. What are stroke symptoms? A stroke can have a variety of symptoms. To readily recall this, use the acronym FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency. Time is not a symptom, but the most important thing here. There can be other symptoms like double vision, headache, dizziness, nausea, fainting, or even cognitive issues like memory loss, confusion, mood swings, etc. Few people are aware of the symptoms. So, for the patient or nearby people, it is best to seek immediate emergency medical help rather than overanalyzing the symptoms. Sometimes people can have these symptoms and feel okay after a few minutes or an hour. It is still important to do emergency checkup and rule out a mini stroke. Mini strokes are also called transient ischemic attack or TIA in medical terms. People with TIA often have full brain strokes in their lifetime. Given that occurrence of stroke is somewhat unpredictable, what are the main drivers for stroke? The number one thing in our control is management of hypertension or blood pressure. So, If you have blood pressure consistently more than 120/80, try to manage that through medication or other lifestyle changes. We will have a follow-up session on this. 401, hypertension. Second and third, not necessarily in the order, are high levels of cholesterol and diabetes. We already had a session, 101 cholesterol and 201 diabetes. I hope you find that informative. In fact, each of the four main diseases that we are talking about, heart diseases, diabetes, hypertension, and stroke, are interrelated, and one affects the other. Like people with brain stroke tend to have higher chances of heart disease over their lifetime. Besides high blood pressure, high blood sugar, and high cholesterol, things that you need to be managing well are body weight and sleep apnea. In fact, sleep apnea by itself is directly related to abnormal body weight. Stress is often underestimated, but over a period, it can become the fundamental underlying cause of stroke. First, stress can directly cause hypertension. Next, it raises the cortisol or stress hormone of the body, causing inflammatory response and body weight. Last but not the least, it causes poor sleep and metabolic disruption. Smoking and regular alcohol consumptions are also drivers for stroke. By now, you probably heard about the ill effects of smoking and alcohol many times. Besides genetic causes, stroke in women have unique causes. As many as 20% pregnant women have problems such as premature labor, gestational diabetes, and other conditions that are labeled as adverse pregnancy outcomes. All those conditions can lead to an increased risk of stroke later in life. Women are also more likely to have migraines, which can double their risk of clot-caused strokes. What kind of treatment options we have for stroke? For stroke, let's reiterate that effective treatment starts when the patient reaches the hospital at the earliest. Depending on the type of stroke, ischemic or hemorrhagic, treatment is very different. Ischemic stroke is treated with blood clot clearing TPA or other blood thinners, depending on the start time of the treatment. Hemorrhagic strokes are treated with blood pressure lowering medication. In both the cases, brain surgical intervention may be required. Beyond hospital treatment, activities of daily living or ADL become the focus of rehabilitation after a stroke. ADL typically includes activities like independently bathing, eating, etc. Strokes can have serious cognitive or emotional impacts, and that needs to be managed as well. There are also evolving recovery treatments like hyperbaric oxygen therapy that provides a patient with 100% oxygen in a pressurized controlled environment. This can improve blood flow to the damaged brain tissues, reduce swelling, and heal. So we come to the last section where we discuss what to do and not do. We do not need multiple recipes to avoid lifestyle diseases like heart diseases, diabetes, stroke, and hypertension. Manage through medication any of the abnormal biomarkers like high blood pressure, cholesterol, and sugar. Have calorie restricted and time restricted but nutrient dense diet. Have 6+ hours of daily sleep in a noise and light free ambience. Manage stress consciously through physical exercises as well as relaxation. Avoid or completely drop smoking and alcohol. Remember again, for stroke, the most important thing is to reach emergency care at the earliest. And it is better to have a false alarm rather than not getting timely treatment. This concludes today's session. We will have more podcasts like this to educate ourselves, nourish, and flourish. Stay tuned. If you like this podcast, would appreciate you clicking the like button and subscribe to the channel.